Hi, my name is Stacey Hayes-Gear, and I have Lyme disease. And a lot of my friends with Lyme or other illnesses have had a lot of questions and concerns about getting a PICC line for your medication. I know for me, I was really kind of nervous about it, and I watched all these videos on YouTube, and they were all really clinical and just kind of scary. And so I wanted to kind of give anyone who's going to get a PICC line or considering it kind of an overview and how it's worked for me and so forth, and like kind of not scary words. I can tell you that the procedure itself was really very easy. I've had pedicures that were more uncomfortable than the procedure. So what happens is that you go in. I had mine done at South Shore Hospital in Massachusetts, the ambulatory care clinic or something like that. You go in and you're just in like a regular hospital room, and you can eat. I had like a bagel while I was waiting, which is a no-no for people with Lyme disease, but I was getting surgery. I didn't really care. It's just super easy. So what they do is they drape you everywhere, and they kick your significant other or whoever out of the room. I had two nurses. They have an ultrasound machine that they use to see where where the line is as they put it in. And they monitor your vital stats the entire time. You're draped everywhere, with the exception of the area where the PICC line will go in on your arm. It's like a window that they leave open. And so what happens is they put this kind of X-ray thing. It's like a plastic Y, and it just kind of sits in your chest. And it does the ultrasound as they're fishing the line through. They just kind of, they numb you locally. It doesn't hurt. I'm a baby about needles, and I had no issue with it. And they slowly feed it up into your chest, and they make sure it's in the right spot. It's supposed to go like down here, or something like that. Again, I'm not medical. This is just my experience. Once they put it in place, there's a PICC lock. You see it? This part here is kind of glued down to your body. Like, it's hard to pull up. They really have to fight to get it off when the nurse comes to change it. And, there's the site where it goes in. And I have a cushion on it because it makes me more comfortable. And some people have extensions on their PICC lines. I keep mine short because it's just less to deal with. Again, for me, the only part that was uncomfortable of having my PICC line put in was at the very end. I just got panicky and nervous for some reason. I don't normally get panicky and nervous, but I did that day. So it was just as they finished. If you're someone who gets claustrophobic or is freaked out about it, maybe ask your doctor to, write you a little tranquilizer or something, just if you get anxious, because that was the only thing for me. I felt anxious at the very end. Probably has nothing to do with the procedure, just me being nuts about being sick. I don't like it. So what I do with mine is I recommend, there's two things I insist on when my nurse comes. My skin is really sensitive. Look at how pale I am. So what I do is with my line, I insist that they use a cushion at the injection site. So they come in these little packages from the infusion company. It's an AMD antimicrobial fenested foam disc dressing. I pronounced all of that wrong, I'm sure. But it's a little teeny tiny foam circle, Now, when they put that on you, you want to make sure that there's an opening on it. You want to make sure that it's not going the same direction as the line. If it does go the same direction as the line, sometimes the line will work its way through. What this does is twofold. Firstly, it keeps the site from getting irritated from the line pushing on it. And because it's antimicrobial, it keeps you from getting any kind of discharge. When I first had my line in, they didn't put the cushion there. And 2 weeks in, I got like a crust, and I had to kind of scrape it off, and it was uncomfortable. It didn't hurt. It was just uncomfortable. It's making a scab. And the other thing is it's antimicrobial. I think I said this already. I don't know. It's antimicrobial, so it reduces the bacteria, and the cushion keeps it from pushing on your arm. And then I have them use what's called an IV 3000 bandage. They don't give them to you like willy-nilly. You have to like ask for it. Say your skin is super sensitive. Why take the chance? Be uncomfortable if you don't have to. It's really a clear bandage. You can barely see it on my arm, and it doesn't irritate the skin. Most of the doctors and nurses want to label your bandage. They'll even want to tape it into place. For me, that irritated my skin, so I said absolutely, positively not. So instead, what I do is, actually, when they would put it, sometimes they would put the tape on to either hold this in place or to label it. The minute they walked out the door, I would rip it off because it just irritated my skin. So what I do instead is I just give the nurse a Sharpie, and they write their name and their date. It was like right here. Usually it lasts the whole week, except I got my dressing wet this week like a bad girl. And when you first have it done, it hurts for about 48 hours. I put ice on it. I think you're supposed to put heat on it, but I think whatever works for you is what's best. I found heat to be the best way to go. And then, what else is there? Okay. So this is what I wear on it every day. Who wants to have their line, kind of hanging out, showing everybody, except me, I'm going to show it to you. So I bought this line cover from a company called Caroline in Fall River, Massachusetts. I have two. I have a purple one and a black one. The black one collects lint a lot. You could probably make more of these yourself. But what this does is, and you can see on their website, they have a little video, but basically it's a PICC line cover. Just looks kind of like a sleeve off a t-shirt. It has a little pocket. Oh, can you see it? It has a little tiny pocket here so you can put, the ends of your line, tuck it away safely, and you just fold over the top and no one can see it. Now, that'll even work with like a triple, the pocket's big enough that it'll work if you have a triple calf or a double calf, it'll still fit. But what I found lately is that, I like when I'm doing my infusion, I'm at home anyway watching TV. So although last night I did the drive-in movie theater, but for the most part I'm at home. So I just fold it over and just kind of cover it up. And it's tucked away, and people think I have a sports injury, and they assume I play tennis or something, and I barely got out of bed. How am I going to play tennis? The other thing that I recommend is when you shower. Now, this is where, I think you'll be offered options, PICC line, central line, whatever. You can't get it wet. You can't submerge it. So when I shower, I wrap it in press and seal and just zip it around it real quick 3 times, pull it super tight, and just stick it on itself. Some people tape over it. I found that when I put tape over it, it was harder to get off, and it really didn't make a difference, and I was going through a ton of tape, and it was expensive, so press and seal it is. The other thing I bought is a waterproof PICC line cover. I bought it on Amazon. It was like $50. These are $20 through Caroline, again, in Fall River, Mass. I think the shipping was like $5. This is a waterproof PICC line cover. I bought the medium. I probably should have gone with the large. I followed the measurements and everything, but it's still really hard to get on. I don't like using it because it's so hard to get on. If it wasn't so hard to get on, I might feel better. Maybe I should cut the side or something. I don't know. Anyway, you put it on, you slide it over your arm, you put this little bulb thingy in, you suck all the air out, and you're vacuum sealed. I've been told not to submerge it even with this. It's just protection, but I've heard other people say they submerge it. If I can't scuba dive, I don't care, and my neurological stuff isn't really working, so there will be no scuba diving for me right now. In terms of doing your infusion, there's a couple of ways that you can do it. So I had, at one point, you'll get, when you're in the hospital, they walk you through this. Your nurse will come to your house and walk you through it again. You feel like, okay, I get it already, but, it can just be overwhelming. So I'm on IV Rocephin. It comes in a bulb, and what I do is this little part screws on, and I just sit, and it just goes in about an hour. Slowly deflates, and you take it off, and you finish your steps. It's not bad at all. At one point, my insurance company was refusing to pay, so I went to a compounding pharmacy called Johnson's Pharmacy in Waltham, Massachusetts, and they will compound your Rocephin for you. Blue Cross covered it for me. Even though they were saying they weren't going to pay for my treatment, they paid for the prescription, which was $60. It came in these massive vials. I mean, it's huge. I would have to sit here put it in and slowly induce it over a period of time. An hour. You're supposed to do like one little line a minute. I did 5 lines for 5 minutes. I'm not a doctor. That's what I did. It worked for me. Not medical advice. Sue me. I don't have any money. And so when you do your infusion, it's basically 4 steps. 4? I don't know how many steps it is. Count for me. First, you take alcohol wipes, which they give you. You're supposed to, wash your hands, sing happy birthday, or Purell. Then you take an alcohol wipe and you rub around the sides. So, and of course, I have someone do this for me because it's too long, but you rub along the sides and across the top 10 times with your one alcohol wipe. Then you have to use saline to flush your line. And, I'm sure you've seen on television a million times the nurses they have to get the air out because they don't want to inject air into your veins. So some people will crack this like halfway just to push the air out. It squirts a little, or you can crack it all the way. But the first step is to wash your hands. The second step is to alcohol the site. Third step is your saline. I have found preparing everything in advance, having the alcohol wipes ready to go, having your syringes, prepared, air-free, and everything, having everything laid out on a paper towel is the way to go, and you just do it as you go. And so you do alcohol, saline, antibiotics, whichever one you have, and then you do the alcohol again, then you do the antibiotics. Then you do the alcohol again, then you do the saline, then you do the alcohol again, then you do your heparin. The biggest problem, I think, with all of it is you just have, not really a problem, you just have to remember. SASH, saline, antibiotics, saline, heparin. Alcohol wipes in between, hands clean. It's not a big deal at all. I've had mine in since March. I had 1 month where the insurance company wouldn't pay at all. Like, we hadn't figured out how to work around it. And I wanted to rip it out. When the nurse comes once a week, but you can usually call. What they do is they put a mask on you during the procedure because everything's open. For me, I found that I kind of started to hyperventilate a little bit. So, if you have trouble with a mask, tell the nurse. They'll just have you turn away or something. They take the plastic off. They take your the lock off. They take the cushion off. They clean the injection site for 30 seconds. They clean the whole area. And then they prep it. They put the new lock on. They put a new cushion on. If you're smart and listen to what I say, cushion. And then they put on the clear bandage. When they're done, what they do is they flush out your catheter, and they'll replace this white tip part every time. So once a week, they flush you out and they replace this tip. And that's it. The nurse will generally take your vitals and, answer any questions you have. For people with Lyme disease, which is what I have chronic Lyme. What I found is the best information that you get isn't from your doctor or books. It's from other Lyme patients. And typically your home health nurse has other Lyme patients, especially if you live in New England like me and it's rampant. So ask them questions. What have you seen in other patients? And you'll find all kinds of pointers that are helpful. And I'll do another video about insurance, and how I was able to get coverage long-term on for my treatment. And just like everything else in this Lyme journey, I would have jumped off the Tobin Bridge, although I think you have to have a fast lane pass now, but I would have jumped off the Tobin Bridge if it weren't for having really great doctors. And I have a little nurse who comes and helps me, my daughter Noelle, and then of course my husband Doug, who is honestly like greatest husband ever. And I hope that this helps you, and I hope that you're healthy soon. Have a great day. Just make it a great day. Like, no matter how sick I am, no matter how many tears I've cried on a given day about how sick I am or how my life is over, I just really make a point of focusing on the things I'm grateful for. And I hope that this helps someone. So I'm grateful for the prospect of helping someone else, and just grateful for that my kids aren't the ones that are sick. I'm grateful that it's a beautiful day in Scituate, and